The holidays are really approaching quickly now. Thanksgiving, less than 2 weeks away.
Oh my goodness. And with more gatherings planned, COVID trends are on the minds of many families right now. Joining us live is Dr. Sandy Nelson, an infectious disease specialist at MGH. Doctor, thank you so much for joining us this morning.
Thanks for having me.
Well, so what should families be thinking about when it comes to gathering again?
You know, I think I, like many others, are really looking forward to Thanksgiving, especially after this really challenging year. For many of us, I think we're weighing the risks of COVID against the benefits of being together as family. And I do want to highlight the importance of the benefit side of that equation. There really is a lot to be gained from being together and really helping those who've been struggling with mental health issues and isolation. But these are situations in which the risks are a little bit higher. And I think all of us need to individually assess what our own risks are. For those that are healthy and vaccinated, and when everyone present is asymptomatic, I do think that there are tools that can help to make these gatherings safer.
Well, for some people, those holiday plans will involve some traveling, which is something we certainly didn't see much of last year. Some states are now seeing an uptick in cases, including Massachusetts. What kind of precautions should people be taking?
You know, it's a great point, because really without travel, there'd be no pandemic. You know, we live in a mobile society, and that's really what's allowed this to spread worldwide. You know, I think when we think about travel, we always think about the risk of the travel en route. What is the risk on the airplane? What is the risk on the bus or the train? But really, the greatest risk for many of us is the risk at the destination when we let our guard down. But in terms of the travel itself, when we can't protect ourselves with distancing, we really need to focus on other things that we can do, including masking. And there are some great masks that are available that really do a better job than cloth masks or even some surgical masks at protecting the wearer. And it's important to really look at and invest in a good quality N95 or KN95 if you are going to be traveling via one of these higher density paths, including air travel or train travel.
Okay, this is a tough question for a lot of people here. What if you're gathering with people who are not vaccinated? How much of a concern is that? I guess it could be someone who is deciding not to be vaccinated, or also very young children right now.
Yeah, I think that that's a really tough one. And I do think that it is, we can distinguish between those two categories of individuals. And certainly for those that are in the 5 to 11 age range, they are likely to have received at least one dose. And as long as they're 7 to 10 days beyond that first dose, they're going to have some protection. So it's really just those that are under the ages of 5 or choose to be unvaccinated. And I think that it's important for those individuals who will be around those who are unvaccinated to consider their own risks. And if they're somebody who is either older or higher risk based on their immune status, then they may consider it not really a risk that is worth taking. But if it's unavoidable, for example, if there are children under the age of 4, then another option would be to consider keeping gathering sizes smaller and also employing testing. We're now seeing more use of rapid tests on the day of a gathering, and that can provide an added measure of safety and security for those who are gathering.
It is hard to forget the surge that we were feeling this time last year. What do you think the winter holds?
You know, I think that we are potentially in for a difficult and long winter when it comes to COVID case rates. I think there are some disturbing or concerning trends from Europe, where countries that are highly vaccinated, even more so than we are, for example, Denmark, are seeing the cases surging as the weather turns colder and as people are moving indoors. So I do think that it's likely that we are going to see cases begin to increase beyond where they are now. And that relates to travel. It relates to the higher prevalence of unvaccinated individuals, potentially waning vaccine immunity, and moving indoors in shared indoor spaces. But I think what may separate this year from last year is that vaccination really does protect against hospitalizations. So we are expecting that even though there may be an uptick in cases, there may not be at least the height of the surge that we saw in hospitalizations. And this will especially be true if the FDA also authorizes some of the antiviral therapies which have been studied for use in early outpatient therapy. So I think it's going to look different than last year, potentially still significant, and I think it's probably still too early to be letting our guard down.
That would definitely make a big difference. All right, Dr. Sandy Nelson, an infectious disease specialist at MGH, thank you so much for joining us this morning.
Thank you.